The question is how we define vaccine, and like always, to be fair, I want to look at the CDC definition first. This is directly from the CDC website, and according to them, vaccine is a preparation that is used to stimulate the body's immune response against diseases. The Merriam-Webster basically has the exact same definition as the CDC. And let's scientifically look at what is an immune response. Now, vaccine stimulates the adaptive immune response in our body. In adaptive immune response, we have both the humoral response, also known as the antibody response, and cellular response from T cells. Now, beyond that, there are also long-lasting memory B cells and T cells that can mount an immune response in future encounters. So, can mRNA vaccine do these activities? Yes, with a small catch, and I'll explain why. Now, we have seen mRNA vaccines stimulate both antibody and cellular responses in both healthy people and patients on their immunotherapy. And here are just a few examples of articles stating that fact. So this data is beyond what Pfizer told us. But we also know that antibody response from both the mRNA vaccines wane after about 6 months or so, and Pfizer's version appears to be waning faster, which may be due to its lower mRNA dose than the Moderna one. The reason quoted from the CDC for getting the booster dose is that antibody levels are waning and it is less effective in preventing any cases of infection. But at the same time, T cell and other branches of immune response are not waning, and this is in part responsible for protection against hospitalizations and deaths. It implies that the booster shot is for boosting antibody levels only and not so much to stimulate the cellular response or memory cells, because the primary series has already provided that stimulation. So immunologically speaking, the booster mRNA vaccine is only fitting part of the definition of a vaccine. Now here is an interesting finding just released on November 8th, and let's take a look. The antibody drugs for COVID produced by Regeneron shows protection against COVID-19 for up to 8 months. This is as good or even better than the antibodies stimulated by the mRNA vaccines. In fact, it appears that the antibody drug for COVID is doing a very similar job as the booster mRNA vaccine. So can we still call the booster vaccine a vaccine, or is it an immunotherapy? Now, we have some types of vaccine mandate long before COVID, but if booster vaccine is only offering a higher level of antibodies, scientifically they are more of an immunotherapy or a prophylactic treatment than a vaccine, and we have never mandated any prophylactic treatments in our society. And some countries are even talking about the fourth dose. Would that be a dose every 6 months? We do not know right now. So if we need antibody levels to stay up every 6 months, then we really should study more on repeating dosing of mRNA in humans. Now, I'm not able to find any real literature evidence at this point, so I cannot tell you what would happen. Now, Pfizer is planning to seek authorization of its booster dose for all adults, and I will wait to see their data before I comment even further.